is Francis Lau, and I am the faculty coordinator for the program. Before we begin, I would first of all like to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, the Esquimals, and the Wasanich peoples, whose historical relationships with the land continues to this date. So to start the session, I'm gonna first ask our Andrea to play a short video clip to talk a little bit about the program. So take it away, Andrea.
The Graduate Certificate in Health Terminology Standards is a one-year online part-time program that provides working professionals in the health industry with the confidence, knowledge, and skills to make sure health terminologies are used appropriately in electronic health records and data exchange systems.
Having professionals that are fluent in terminologies is really critical. We need to give Canadians the confidence that the information that we collect in one place can be shared across systems, across organizations, and really maintain the precision of its meaning.
Terminology standards is a key practice area within our profession. It provides the foundation for clinical information sharing and effective communication in healthcare. Standardized terminologies are required to efficiently share patient records in the electronic health record and for management of increasing volume of electronic health information across the continuum of care.
The type of impact I'm hoping to have with my certificate is to improve healthcare in not only the Lower Mainland, but across Canada. We are very behind in technology here in healthcare in Canada, so I want to be part of that movement in creating a better healthcare environment for all Canadians.
The certificate in terminology standards was attractive to me because I work full-time. I have 4 children that I need to support. Secondly, because yes, I can maintain my life, my lifestyle, my obligations while learning. So all of the knowledge that I got from the coursework, I can directly apply it to the work that I'm doing at the same time that I'm doing it. Rather than learning the theory, doing a couple of projects, and then trying to apply it in a career down the road, I can actually learn something in a course one day and apply it the next day.
Okay, thank you, Andrea. Let me go and share my screen again. So that was the video that you watch that's coming from this particular web page. So you can take a look at it again if you want to watch it again. So in the next 20 minutes or so, I'm going to provide some information on the certificate program and on how it can help advance your career. And then Raman Dona, a recent graduate of this program, will share her insights on why this program is important for you to consider. Please note that we will be recording the presentation portion of this session. And during this session, if you have questions, you can type them in the chat box or raise your hand and we'll be glad to address them, or we can address them afterwards as well. So here's the agenda. What is this program? How is it going to help your career? Insights from those involved, and where do I get more information? That's what we're going to talk about today. So as you can see on this slide, it's a busy one. The certificate program has 4 graduate level courses that you can complete part-time in 1 year while you work. The courses are all done online in real time, weekly evening classes from 5 to 7 p.m. Pacific time. There's also a 2.5-day virtual workshop done in the 3rd week of May each year. And many of the classes in the 2.5-day workshop are jointly delivered by with our partners, Jevity, which is now Accenture, and RKL Informatics and Ontario Health Digital Health Standards team, which are all industry leaders in health information standards in Canada. Now, the first course is Health Information Standards, HIN 535, done over 13 weeks starting in September. This course introduces you to different types of terminology standards for capturing clinical events such as diagnoses, findings, assessments, and medications, as well as data exchange standards for sharing patient information through electronic messages and documents. There will be hands-on learning experiences and term papers, so you can apply the concepts learned in real cases. The second course is HINT 536 on controlled terminology standards, also done over 13 weeks starting in January. This is where you will learn more about specific terminologies such as SNOMED CT, which is a reference terminology for diagnoses, clinical findings, body sites and organisms, etc. You will learn how to use these terminologies such as creating subsets, extensions and cross maps, and querying patient records. You will also learn about how to implement and support these terminologies in health organizations. The third course is HINT 537 or Health Information Exchange. It is done in a compressed format in 6 weeks. In addition to the weekly online classes, there's a 2.5-day intensive virtual workshop in the 3rd week of May. And the course will introduce you to real-life standards-based healthcare applications and case studies for different areas such as immunizations, medications, imaging, lab tests, and clinical reporting. The emphasis is on the appropriate use of terminology standards in these healthcare applications. The final course is HINT 597, which is a capstone or field project done in 3 months from June to August. And this is where you will apply what you've learned in the previous 3 courses to work on a practical terminology related project. So here are some examples of the field projects. And the topic is typically framed within a standards life cycle, which covers needs identification, standard specification, development, deployment, and maintenance of a particular standard or standards-based application. Some of the examples projects are here: identify requirements for a specific terminology for use in health organization, develop a business case for a specific terminology for health organization, or analyze local clinical terms, coverage, and usage in the e-health system. And when it comes to specification, it can be something like analyze and evaluate the controlled terminology governance options and develop recommendations. Or it can be to analyze technology specifications for a specific health information exchange standard being developed. It could be to develop specifications for a structured data entry or retrieval template. And in development, it could be to map local drug terms to the Canadian Clinical Drug Database. We also call it CCDD. Or it could be to create a specific SNOMED CT subset for a health organization. It could be to create a SNOMED CT education program for a health organization. Then with respect to deployment, it could be to create an implementation plan for a specific terminology in a health organization, such as the SNOMED CT we talked about, or to develop a user engagement strategy for an organization to adopt the HIE standard. Finally, for maintenance, it could be to develop an HIE maintenance plan for an organization with a focus on terminologies. It could be to evaluate the quality and use of a specific SNOMED CT subset for a health region, or it could be to evaluate the impact of a specific terminology subset on the quality of use. So you may ask, how does this program help with my career? For the certificate graduates, the typical profiles of some of them, they include nurses, doctors, IT professionals, health information management analysts, and project managers who want to learn more about terminology standards. And upon the completion of this program, you will be eligible to apply for the Certified Terminology Standards Specialist, or CTSS, which is a credential from the College of Health Information Management. And with the knowledge gained from this certificate, you will be working on all kinds of terminology standards projects, health information exchange, and interoperable electronic health record projects. And in fact, often you become the go-to person on terminology use in projects that involve the use of these information exchange and terminologies. And next, I'm going to provide you with an opportunity to meet with a recent alum who's going to speak to you about her experience. So here I'm going to introduce Raman. Raman, take it away.
Hi, everyone. I am Raman Danoa. currently working as management consultant in Accenture. My background is computer science. I have completed my master's in computer science in 2016, and I finished the UX graduate certificate program last year. And in my current role at Accenture, I am working very closely with FHIR standard and sort of working on these different assignments, working on FHIR implementation guides such as structured data capture, Da Vinci project, enhancing FHIR implementation guide templates, and most recently providing FHIR support to Ontario Health's COVID immunization project. So why did this program appeal to me? From my work experience, I have experience working on HL7, CDA, and FHIR, but all of these health exchange standards use these different terminologies, such as SNOMED, LOINC. So basically using these terminology codes to determine what kind of exchange it is. So that's when I got really curious to dig deeper into these terminology standards, as in I wanted to better understand all these different kind of terminology standards available in Canadian health space and how to effectively use them. And on the other side, this program really bridged my knowledge gap between technical and non-technical words coming from a very technical background. And I think that's a very essential piece to create the positive transformations within healthcare industry to better understand each other's language, as in from informatics world. And the last point, which I think is really important from full-time professionals' perspective, is this program allows you to study while working full-time. So since classes were from 5 to 7 p.m. Pacific, so that works really well, and you can still do your full-time job with it. And how has this program helped me? As I said, it gives me a comprehensive understanding of these different health terminology and health exchange standards in Canadian health space. But also, this program has helped me expanded my knowledge on FHIR itself, especially Smart on FHIR side. So my field project in the last semester, I created the Smart app, which was patient portal. So idea was this portal will allow patients and clinicians to view patients' clinical information such as allergy, procedure, immunization, vital signs such as height, weight, blood pressure, and so on. So the beauty of this app was it has this flexibility to integrate with any EHR for providers to see their patients' health data within their clinical workflows. So yeah, that was very helpful for me from my professional experience. I feel more confident to advise other folks or clients on when it comes to Smart on FHIR apps, FHIR solution architecture, and other sort of development advice if I have to give internally to clients or to other teams. And of course, this wouldn't happen possible without all of these knowledgeable and very flexible instructors and speakers who were involved in the program. Yeah, thank you.
So thank you so much, Raman. If folks have questions for Raman later on, after the presentation portion, I'm sure she'll be glad to answer them as well. So here is the school website with some additional information on how to apply program requirements, insights from industry experts, and in terms of profiles of some of the certificate alumni, such as Raman, who have just spoken to you just now. And here's some information in terms of the deadline. Deadline for the fall term is June 1st for the September entry. And you can contact myself or Sandra Bowen, who is the graduate admin assistant. Sandra, would you like to speak up and say a few things?
Hello, everyone. Welcome. Nice to see all of you. As Francis mentioned, I'm the graduate program assistant, so I'm a contact for you if you have questions. Also, I'm a point of contact for the application. So the application deadline is June 1st for this September 2022 entry, I really advise you to apply as soon as you make the decision that you're interested in applying to the program, because there are documents and things that you need to upload to the application. And if there's any issues, then you can contact us and we can help you. But don't wait until the last day of May or June 1st to submit your application. Earlier is always better, but we're here to help you when you need it. So welcome everyone, and thank you, Francis.
Thank you, Sandra. I think we have a bit more information here. So again, here at the school website, the URL, and you can find more information about the program overview and the admission requirements, how to apply, and the tuition fee, etc. And there's also the Canadian College of Health Information Management website, where you can find more information about the certificate itself around the credentialing of the CTSS designation. So at this point, I believe this is the end of the session. We're going to be recording the session, and the recording will be made available on the school website. So if you want to go back to it or tell your friends about it, your colleagues, they can listen to it. We'll release it as soon as they're ready. And at this point, I'm going to pause and ask people for any questions. And I believe this is where we're going to start recording as well, right?